Hi, Amanda. This is Rachel Martin from Blue Cross.
Hi, Rachel. How are you today?
I'm doing pretty good. How about yourself?
Good, thank you.
Wonderful.
Hi, Amanda. Tricia Litzenberg is here from IBH.
Hi, Tricia.
Good. Okay, it's 1:30. I call to order the quarterly meeting of the Mohave County Employee Benefit Trust Fund Board of Trustees. It's Wednesday, September 1st, 2021 at 1:30 p.m. Do we need a roll call?
Supervisor Angus,
Here.
Verlin Tennille, Susie Perel-Duranzo,
Here.
Roger Jacks. We have quorum.
Thank you. Okay, official business to come before the EBT board. First, we have the call to public. Is there anyone here from the public who would like to address this board? Going once? Going twice? Call to public is closed. Discussion, number 2, discussion, consideration of, and possible action regarding IBH provider contracting process. Mr. Collins.
Madam Chair, Aaron Collins. I'm the area president from Gallagher Benefit Services. I had to say that just to watch smiles. What I'm going to do, I'll just tee this one up a little bit, Madam Chair, and then kind of go from there. So, Tanya, are you on the phone? Tanya and Tricia?
I'm here.
Tanya and Tricia?
Tricia's here.
Okay, Tricia. All right, Tricia, I'm going to just tee this up, and then, Madam Chair, with your permission, I'll turn it over. So, Tanya and Tricia are here from IBH. So, what's happening in the background? The reason we're bringing this to the trust. You'll remember that we replaced the EAP provider about a year ago. We had some issues with the former provider. We bought in off a joint purchase the provider for the NAEBT, and that's IBH. And we're running into some issues with them as well on contracting. The scene I want to set is basically we have two things. There's service issues and we've got contracting issues. So nationally, not surprising, there is a problem getting to mental health providers, both in person and electronically for a variety of reasons. In essence, what it comes down to is some are not seeing patients, some are not seeing in person, that type of thing. And then in the instance, which has not hit Mohave to date, but Arizona has a very specific statute for first responders that gives them some additional benefits in instances of PTSD-like episodes. So what I've done is I've asked IBH to just give the board a general background on the contracting process, how they go about finding vendors, how they go about determining what level of qualification gets onto the network, and then just answer any questions that you have in terms of where they're at in the process of contracting. So with your permission, Madam Chair, I'll turn it over to Tricia, and then I'll have a seat and come back for the next item.
Thank you, Madam Chair. My name is Tricia Litzenberg, and I am the Client Success Manager for Mohave County. And I am here to discuss...
Whoa. 1 second, Tricia, we're having some technical difficulties. IT?
Okay.
Is anyone from IT here? Sam? I don't see anyone back there. Jeremy is? Is he working on it? Let's see if we can, because as of now, I can't understand what you're saying. So, Tricia?
Yes.
Okay, maybe if you speak a little slower, maybe? Does that sound right?
Sure. I can try.
Okay.
Can you hear me now?
It's just we have very bad feedback. Is
Okay.
Jeremy, is there a way of maybe calling back? Are you on a cell phone or a landline, Tricia?
I am on my cell phone.
Well, I'm not sure this is going to work.
Is this,
Excuse me? What did, I didn't even. You say
Can you
that
hear
you
me
were on a
better?
speakerphone or a landline or a cell phone?
I am on my cell phone.
Cell phone. A speaker on your cell phone?
No, I am on just on my hand, just on my cell phone.
All right, that's a little better. Let's see how far we can go.
Okay. So I am here to talk about the IH provider issues. So with IH, we know.
I'm just wondering if everybody on the other end can mute their phone, if that would help us hear Tricia better.
You're saying that people who are on the phone, other people?
Yes? Yes. I'm just wondering if everybody on the phone can mute, and then maybe we'll hear Tricia
Is
better
it,
without
okay,
that
let's
feedback.
try that. The other people on the phone, can you, if you haven't already, can you mute your phones? Okay, let's try that.
Thank
Okay.
you. So, Madam Chair, we are here to talk about the IBH provider relations. We know that the nation is facing a mental health crisis due to the national pandemic. IBH is currently providing an audit of all of their providers. With this audit, we are reaching out to every provider to ensure we have the correct contact information, including their telephone number and their current line. Because of the pandemic, many of our providers had to close their face-to-face offices back in March. Some of these providers have opened back their offices for face-to-face counseling, but their locations may have changed, and this audit is going to help us provide the correct and most accurate information for all of our members. With this audit, we're also going to ensure that we have the most up-to-date information for our members on who is currently accepting new patients. Of course, we're always looking to secure additional providers in Arizona. While our list is proprietary, we are working closely with Gallagher to ensure that all of our members have providers available to service their needs. We have provided in your board packet a memo on page 3 that gives you some information regarding the credentialing requirements for IBH. As you are aware, we do require a master's level or higher for all of our providers. Our providers must also be independently licensed, which means they may not work under another provider. In this memo, I have listed a couple of the licensing that we do accept. I've also listed some of the recruitment efforts that we are currently in process in Arizona, as Arizona is the #1 priority for our network relations team within the nation. There are 2 websites that are listed here, which we are using as a reference to look for current licensed providers within the state of Arizona. We are using this list to contact providers that are available and meet our credentialing requirements. We are also posting on job boards, and always we are taking nominations from clients or members. If you look in your board packet, starting on page 6, there is an example of the efforts that we are currently doing across the state of Arizona. We did use Mohave County as an example of our efforts and how we reach out to potential providers within the state. As you can see in that list, it shows all of the potential providers in a certain area. It shows who is eligible and who is not. If an eligible provider may have moved out of an area, which makes them no longer eligible, who we've reached out to and may not have been responsive, and those that are responsive and are interested in joining our network, who we will continue to work with and try to get them into our network. We're also working on helping our members understand the process into getting EAP sessions and letting them know with this pandemic they can see a provider not only face-to-face, which is our traditional means of seeing a counselor that we have all known, but since this pandemic, it has opened new HIPAA-compliant ways of talking with a provider. We have phone, video, and live chat, which are all available for your members. And these are going to be the fastest way to currently see a provider, as some providers have not opened back up their offices for face-to-face counseling. IBH has also IBH has also implemented a new text-based tool. This is an opt-in feature that started on August 16th, which will allow members to receive a text message 72 hours after they receive a list of providers. So when a member calls in and gets authorization for seeing the provider, they will reach out to that provider list. If they opt in, 72 hours later, they will get a text message from IBH asking if they were able to connect with a provider. And
Hello? You still with us? I guess not. Okay, well, I guess we'll wait for the call back. Okay. Susie Duranzo? You still on?
Yeah. Yes, I'm here.
Okay.
Rachel Dinner from Blue Cross.
Tanya's here from IBH.
What is That's Tanya. Okay.
Trisha's here from IBH.
Yes. Trisha just let me know that she lost connection.
Okay. Is she going to call back or do
I'm
we?
here.
Okay.
Oh, she's back.
Okay, you're back.
My
So-
apologies.
No problem.
Okay, so I'm not quite sure where we lost connection, but IBH has implemented this new text feature that will allow members to get a text message 72 hours after receiving their provider list, which will ask them if they were able to connect. And the member will be able to respond back yes or no. And if they were not able to get connected with a provider, we will able to assist them at that time.
Okay. Anything else?
Nope, and I just included in the packet on page 5 a new flyer that we can share with your members regarding the connection and requesting counseling. Is there any questions?
Is there any questions?
So from this list, we only have like less than a dozen for the whole county that are eligible or that are participating?
That's correct, that are currently in network for face-to-face. We, of course, have more eligible for televisits, whether it's over the phone or even virtual, but for face-to-face visits, that is what we have in network currently.
And it was hard to hear, but so my understanding is because most of these that are not eligible don't have the master's degree, is that correct?
Either they do not have a master's degree or they are not individually licensed. If they are associate counselor, they do not. If they are substance abuse counselor, they're not eligible.
And of those providers, those are active providers too. Our provider relations team has done a really great job of going out and surveying our providers. As you can imagine, when COVID hit last year, many providers, and Tricia mentioned this, that many providers closed their doors and, are no longer in practice. Some have passed away, and their contact information has changed. So as we've gone through this provider audit and making sure that the information is correct, those are providers who are active, who have responded to our survey and updated their information. Providers who did not respond to the survey are still in our network. They're not in active status, and we've let them know that you are not in active status until we can verify your information, because we need to make sure that we're providing good referrals to members. We need to make sure that we're providing referrals where the phone number is good and the provider is taking new patients and all of those things that are really important to getting good access. And that's going to be an ongoing process, of course. As you can imagine, things change on a daily basis. Providers' schedules fill up very quickly. So those will change, and we'll be adding and removing providers as needed to make sure we have a quality network.
Madam Chairman, I have a question.
Go right ahead.
For the listing that you have, there are some individuals that are considered not eligible. Is that because they don't have a master's degree, or what is the deal on those they're not eligible?
So based off of their license, the type of license that they have, it makes them not eligible. So for example, on page 6, the very first person has an associate, there is a licensed associate counselor. That person is not eligible because it's an associate counselor. They don't have the eligibility based off of their license type. The same is true for the second person. It's the license type that makes them eligible.
Okay. And the licensed master social worker, because I think these are on a masteral level, their license will not allow them to provide the counseling? That's why they're called not eligible? Okay.
Correct. So we're looking for a licensed clinical social worker is the credentialing requirement that we need to have. They need to have that clinical social worker.
Okay. All right. Thank you.
Madam Chair,
Sure.
question?
Okay, does that answer your question, Susie?
Yes, ma'am.
Okay. Roger?
I was wondering how many licensed providers would you need to provide quality service that would be expected from employees?
Typically what we do is we look at we look at the area.
Okay.
And we determine how many member lives or how many employee lives are in that area. And Provider Relations does a calculation, and I think it's one provider for every 40 employees is kind of the standard. However, in Arizona, because the need has been so great that we are continuing to contract with providers. Even if we meet that ratio, we're still continuing to recruit providers as we can. We've had jobs that posted on job boards. We're continuing to reach out through these websites Tricia has shared. Our Provider Relations Department is on the phone calling providers, and we are accepting those nominations. And so as we're able to add to that network, we absolutely are. Does it answer your question?
Madam Chair.
Yes, go ahead.
The question I have is related to the interested. So clearly we have fewer than we would like to have. I see few interested, and the question is, what does that mean, and how long will it take to bring them under contract?
So, interestingly enough, I had a call about this today with our provider relations department, and it involves a number of factors. With our provider relations credentialing team, those can be pushed through fairly quickly as long as we have all of the information that we need. So, for example, there's two in a different state, but what we were reviewing is the two that have been in credentialing for a couple of weeks now. It's on the provider side. We're waiting for additional information that we need from the provider. Their malpractice insurance may have expired, and we cannot finish their credentialing until that policy has been renewed. So there's a lot of factors that go into that, but knowing if we have all of the information that we need, that credentialing process is actually very quick, about maybe a week.
Okay. Again, I find this very confusing. I'm looking at the Bullhead City, which is my district, and according to this, there's only one that's eligible, that is in network, only one. Am I reading that right? A psychologist?
Tricia, I don't have the list in front of me.
No.
Can you confirm?
No, that is, we do have more than one person in Bullhead City that is in network.
But they're not on this list. Oh, there's two. I'm sorry. There's two.
Yes.
Wow, but look at all the different licensed, I mean, you know, we've been going around this for a long time, that it's very hard for Mohave County. It's like a cycle, because we can't get the type of professionals to come here that obviously you guys require. So is there any sort of, Erin, what's the word when you give a consideration, like there's a special, they make a special consideration because of
Exception.
problem, like some kind of exception, yeah, some kind of exception for someone like, for some, you know, rural areas like ours, that we just can't get the kind of professionals you guys require. So it looks like there's lots of people who are licensed, but our people can't use them. That doesn't really kind of seem right.
And just a point of clarification,
So
Madam
they're
Chair, that's
licensed,
for in-person.
But
Excuse me?
That's what she's talking about is available for in-person. Just to
Right,
make sure
but
it's
people,
understood.
a lot of people want to go in person.
Understood. I just want to make sure that was clear.
Madam Chair.
Yes.
yeah, and then, you know, this is something that we have shared with provider relations, but these are standard credentials that many EAP companies across the country require this certain level of licensure to be able to deliver these services. And, you know, we can, again, say we have been asked to ask for an exception in this area. Tristan, I cannot promise anything. This is above us. We can certainly take it back to the team and ask for this exception again. I will tell you, we've asked for this in the past based on client requests, and, you know, the licensing requirements have remained the same.
Erin, how much do we pay per person for this?
Amanda, are you on the phone? Could you pull up the budget real quick and take a look at what the PEPM is?
For IBH?
Correct.
Correct, yes.
I'm pulling this up as well, Amanda.
Hang on a minute. I think I got the budget. I realize it's in the packet. $2.15 PEPM
Per person,
per employee per
per
month.
employee?
Correct.
Okay. And do we know how many people have used this? Even with the call, there's not many places they can go. So calling in, do we know how many people have used this?
We do not have a current report.
I just want to, make sure that this is a benefit that is actually worth it for people. Because if people want to go to one of these places and they can't get by insurance, so maybe like a one-on-one, we can consider one-on-one to see if we want to pay for it. I just don't know.
And that's kind of the dilemma, Madam Chair, because the dilemma that we have in here is that we're seeing the issue statewide with multiple providers in terms of availability for one-on-one, both because of just COVID practice and then because of the overwhelming numbers, okay? So the easy answer is we can say we go out to RFP. So we go out to RFP and we ask the question on what the level of credentialing is that's required, and then how many are actually seeing patients in these cities that are seeing one-on-one, right? And I say this reluctantly, but the reality is I'm not convinced we will get past that issue on one-on-one right now. So I believe we can find technology. I think we can get technology solutions that will do it if people will do it, but we know people want to sit one-on-one, face-to-face with a counselor.
Right, they want to sit one-on-one with the counselor, and then we make that pool so small.
And do we broaden it, and can we broaden it past that with either this vendor or a different one to make a higher number of counselors available?
Right.
Again, that's a solution we can pursue with these guys or through a competitive process.
Anyone else?
Madam Chair, it is very concerning because the majority of the employees in Mohave County are in the Kingman area, and there's 2. How long does it take to get an appointment if you wanted to see one of these?
I can't speak Madam Chair, Verlin, specifically now, but I can tell you it's running weeks. If you're going to go face-to-face, it's running weeks. I know that across the state. And when I say that, Verlin,
it's running weeks.
2 to 4, easily.
Right.
Yeah.
And for people who need help right away, we're seeing that even in drug treatment because of the way insurance companies pay, that it's always the client who gets the raw end of the deal. They're waiting weeks and weeks. There's beds open, but because insurance doesn't. So this is just something I believe that the whole state is going to have to look at, not just us, but again, as far as we're concerned, is this worth it for us?
I would
and this is a huge, I'm sorry, Erin.
Go for it.
I was just going to say, this is a huge concern and something that we are paying very close attention to. I'm sure you're seeing this on the news, but this is a healthcare crisis. The wait time for face-to-face counseling across the board is concerning, whether it's EAP or to the health plans, going direct. Providers are spread thin, and that's why we've really pushed to offer our virtual option that includes video counseling for those members who don't want to have that wait, who want to have their session delivered. And by offering the video, it's giving at least that face-to-face feeling, even though you are on your laptop or your cell phone or tablet. It is something that we are paying attention to and working towards, and that's also why we've implemented the texting tool to be able to follow up with these members and not have it go 2-3 weeks and they give up. We're able to follow up within 72 hours and say, you weren't able to make a face-to-face appointment. Would you like to consider video counseling? And then, as I said, we will certainly take your concerns back to our leadership and stress that because you're in a rural area, you're asking for this exception in the licensure requirements. And we'll do what we can to try to get that passed through. I can't guarantee anything at this moment on that piece.
So just for clarification, so the video option, if it's still just a couple of providers, what is the average wait for video?
So the average wait for video is about 72 hours. Sometimes you can actually have your appointment within 24 hours. The average is 72 hours.
With
and
an
the thing
approved...
with that is that opens it up to the whole state. It gives us we have a separate network for our virtual option, and the provider has to be licensed in the state. They don't have to live in Kingman. So a couple of things with that. It gives much more access to that video counseling. It also provides that additional layer of confidentiality, because I live in a rural area too. I understand that. And sometimes people don't want to go to a provider in their community because they know them or they know who they are, or, they're in the same circles. And so by providing this virtual option, they could be speaking to a provider in Phoenix or Tucson and have that additional layer of confidentiality.
Okay, any other questions from the board? Okay, what are we being asked to do?
Madam Chair, it does wrap it. I mean, the answer to the question is it working? The answer is no, and that's why we're here, right? Because we are running into those issues. We don't want you guys getting blindsided with phone calls. So really the question is going to be, what do we do now? So I think where we are right now is we circle back with them, see what we can do on the issue of the credentialing level, if that's accessible. If it's not, if we can't get it to fix, then we would sit down and have a frank conversation about if and when and how to conduct an RFP to see if we can get a vendor that does it. I think, again, the reason I say we have to have a frank conversation is there are certain issues in here that are endemic that we're going to deal with, right, that we're not going to be able to get past. I don't say that to defeat us. There's a limited number seeing people. We got to recognize the reality of that and then see if these guys can fix it on the admin side.
Okay. So
Madam Chair, can I ask one more question? Erin, what would it cost if the county wanted to just hire somebody that's licensed to do all of our people one-on-one?
I have no idea, Madam Chair. I've not thought about that one on the licensing credentials availability. I've not ever looked at that. This is running about I think it's $33,000 or $36,000 a year. I guarantee we can't do it for $33,000 or $36,000. If you hired a full-time person, we're not going to do it at any level of credentialing at that.
Well, it wouldn't necessarily have to be a full-time person, but just one person that we could send everybody to, and perhaps maybe even give them some type of priority or something when they're scheduling.
Or an exclusive contract or something.
Yeah.
Right.
Okay.
yeah, maybe one in every city.
We've never looked at that. We've never considered it. So I don't know, but we can.
Thanks.
Okay, so are you going to come back with some kind of report?
We're going to wind up huddling, and we will come back. We'll huddle with HR and Ken and Jade and walk through it.
Okay, and so there's no action to be taken on
Correct.
this?
Nothing at this point, Madam Chair.
All right, thank you. Trish? Okay, next up, wellness update.
Missy.
Hi, thank you. I hope everybody can hear me okay.
Yes.
You're good, Missy.
So good afternoon, Madam Chair and trustees. So I wanted to walk through a quick update of the wellness program to date. And so what I wanted to do before really diving into the participation screenings and upcoming screenings and the other programs, wanted to bring to your attention an observation that I made, and it's regarding the last several years of screenings. So as you read through the memo, I'm sure you noticed that quite a few, most if not all, screenings have had a decline in participation, most notably over the last probably year and a half. And so I met with the Wellness Committee back in August, and we talked about what some of those factors might be playing a role in decreased engagement across the board with the screenings that I have laid out for you in the memo. And so we talked about the fact that COVID certainly would have played a part in two capacities. So whether a member is concerned about their own risks and so declining to go through the screening itself, it can also be related to the vendor themselves actually limiting the number of appointments that are available. So between having not as many availability to schedule, we'll see a reduction in the number of members being screened, of course. And so that certainly plays a part on the COVID side. We're also seeing that there might have been other events that are taking place around the same time. And then also some of the marketing might be getting a little bit stale. And so what we discussed was coming up with different ways that we can help manage that through the wellness program and through different tactics. So this could be things such as more appointment slots being available, working with the vendor to adjust the schedule to accommodate the typical participation we've seen. Last year was kind of a scramble, and so it made it difficult to get an idea of who was going to participate based on canceling or scheduling. Also walking through marketing. What are some other opportunities we have to get the word out? Email is always the best way, and when surveying employees, they indicated that that was the most impactful way to get information to them. However, we talked about also doing inter-office mail, so printing the marketing materials and sending it out to management to be able to post and distribute. We find that having marketing come from a supervisor or management position, members might be more inclined to participate and engage. So this would be another mode of being able to get the word out. We talked about direct mailers and things like that to help with obviously getting the word out. Videos also to help remind members about the importance of these kinds of screenings. And so what we agreed upon, which would be the most cost effective initially, was to look at printing and doing the inter-office mail, and then also looking at some short videos that we'd be able to record and have distributed. So we're going to give these tactics a try and see if we have an impact on the upcoming screenings, which include the flu vaccination clinics, but then also mammography and POP. So we'll certainly try to put some of these tactics to work and evaluate and see how effective they are and report back, of course. Happy to answer any questions at this point, and otherwise I can continue moving forward.
You have a question?
Okay.
Yeah, I do have a comment.
Please.
There are a lot of people in the county who never, ever look at the county webpage. So if you don't look at that webpage, a lot of times you miss some of these announcements. In the year of COVID, a lot of people were working split shifts, 1 week on, 1 week off. And if it was your week off, the screenings were usually all in 1 week. So, you missed those screenings. But my issue, and I think I might have said this a year ago, is we just need more notice. There's a lot of departments whose calendars are full 3-4 months in advance, and I was just looking at one of these, and something is coming up the end of September, and it's not on any of my calendars. I haven't been notified of something coming up this month. So I don't remember if it was the health fair or what it was, but we just need them calendared further out, just so that we can try and accommodate the schedules of employees. But and sometimes it's just really hard when everything's in one day or even 2 days, especially with COVID and having to stagger shifts.
Any other questions?
Sorry.
Susie, do you have a question?
And then, in response to that, I just wanted to add, this is Missy, I just wanted to add that we had worked with Jade in being able to develop a longer-term calendar, so that way there would be a general time frame of when these screenings, are taking place. And so, unfortunately, we're sometimes at the mercy of the vendor in their scheduling. Our goal is always to try to get dates locked in 4 to 6 months prior, but unfortunately, that doesn't happen for all of our screenings, but we do our best to try to get the marketing out to HR within a timely fashion. But I can understand that having limited staff, the limited in-office hours, and having to stack these screenings within the same time frame, we're really, again, at the mercy of the vendor. But what we can do is continue to push vendors to get a finalized schedule so that we can get the marketing out earlier, so that way members have the opportunity to schedule those appointments earlier and be able to check their own calendars against when these are happening. I do want to make note that we are going to be doing a survey of members to get an idea of what are some other barriers to participation, so that we can get ahead of it and really try to maximize engagement and reducing those barriers. So that's something that we're going to do in collaboration with Human Resources during the flu vaccination clinics this year.
Are we really going to have flu vaccinations? Because apparently there's no more flu left. That's what it says on all our reports. There are 0 cases of flu. Just wanted to
I think
throw
it's
that
because
out.
people are washing their hands.
Okay. We'll go with that one.
At this point, we do still have it contracted for the end of this month and early October.
Okay. So HR, Jade, Ken, do you have other ideas as to how to get this in? We've been every year we talk about it.
So currently, if you were to visit the benefits webpage, I do have a yearly calendar posted. So if the marketing material is not yet available, you can go and search the calendar by the month, and it'll tell you what screenings to expect in that month. It's January to December. Some of the issues that we do run into, as well as contracts, with the identity theft protection being added into our contract, that has somewhat added a delay to get vendors to agree to our terms, but we have to at least try. So that's also kind of created a delay in distributing marketing material. But I think people are getting tired of emails. I've shared that with Missy, so I'm really hoping to get attention. I would like to see us start doing video, kind of like video advertisements, something fun, something different, as well as continuing to make sure that we do have a yearly posting for people to be able to view, especially like with the courts. They're very busy regularly. So just making sure that the word gets out there is very important.
How many public works people actually look or even have access to the calendars to read those? Or, that's another department, but, and you were just talking about the courts, and I'm wondering, because, we have different systems with the courts, can we get that calendar posted on the court's calendar as well as the county one? Because half the people in the courts have probably never looked at the county webpage.
That's a really good point. I can certainly reach out and see what we can get available on the court's website. For individuals such as Public Works, we do, like for example, POP is partnered with the city, and it starts very early, 6 a.m., to try and get those employees who have an early workday and who have to beat the heat, essentially. For that, Public Works, I think there was an idea that came up at the committee to do just send it in our office to get to those employees who might not have computer access. So we're definitely going to start doing that as well. So we're not solely relying on technology, but we're trying to use every avenue available to us.
Okay. Anything else? That's it?
Yes, I had just a couple more things to make note of that I wanted to walk through. I'm actually going to jump to the last page, if that's acceptable. So I wanted to bring to your attention the Livongo numbers. As a reminder, we did transition from Livongo for diabetes, so solely focusing on one-point solution, to expanding that to the whole person solution. And so Human Resources, ourselves, and Livongo partnered to effectively communicate this program. And so I'm actually really pleased with the numbers for the Livongo solutions. As far as the number that are enrolled in diabetes, I think previously, before rolling out the whole person, we had about 52 enrolled in that program, and now we're at 68. I did pull numbers from January through December of 2020 on how many members had a prescription for diabetes medication, just to get an idea of what percentage are we actually hitting based on the eligible population. And so with 68 enrolled, 129 having a medication for diabetes, we're at 53% enrollment, which without any kind of additional incentive other than the cost of the program being covered, that's really fantastic. 53% is usually tied to some kind of incentive we've seen with cost share waivers and things like that. So I just wanted to bring to your attention that through all the efforts that HR is doing and just trying to bring this program to light, 53% is really great to see in this kind of program. Generally, across the industry, you'll see maybe 10 to 30% whenever there's a program like this implemented. So I just wanted to bring that to your attention. This is really fantastic to see this number engaged in the program. And we'll continue working with HR and Livongo and making sure that we market this program to eligible populations within Mohave County. So I'm happy to answer any questions on anything else throughout the memo, but I just really wanted to highlight the success of the diabetes portion.
Any questions? No, thank you.
Madam Chair?
Yes.
Can I just, I'm pleased with that number, and boy, I'd sure like to see it go up a lot too. Would this be the time to ask about COVID shots, and is that something that would be beneficial to throw in this area as well? I don't know that we've ever specifically said, come to the county building and get a COVID shot, if that would make our numbers go up, down, or if it would be indifferent.
I'm trying to address that. The COVID shots are covered 100% on the plan today. So any provider who can provide them, it's like the testing, Vernell, it's 100% covered if they walk in.
Any thought of coming to the county building, the admin building, and doing those, or out at Public Works to
We have not
do
because
those?
of the special refrigeration requirements. And to our county, we've got 9 of the counties in the state that are clients. They've been administering them by setting aside times in their health department or advertising the dates and times, because that way they handle that and they handle all the record keeping and reporting for the feds. So the short answer, it's available. It does take special treatment still. They haven't got a vaccine yet where you don't have that special refrigeration requirement. And it might be a really good one to partner with the health department on to do, just because of that. We don't have any vendors out there that we're aware of that are mobile with it as of today.
Okay. Any idea what the cost for COVID treatment has been for the county?
We are north, actually Rick can answer that, we're north of $1 million, I believe. I believe we're north of $1 million. Okay, you can check. We have that broken down based on treatment and testing and whatnot, but Rick will pull up a report.
Okay.
Just wanted to add the cost of COVID. We're also tracking the positive cases, the quarantining at home, and the impact of that on the county budget as well. So there are multiple layers or facets for that cost. And related to the vaccine, public health is gathering that information. It's listed on our county website as well as far as providers. And for initially when the vaccine was in more demand than was available, public health was involved in facilitating and ordering and distributing. We no longer are doing that just because the availability of vaccine is abundant and it far exceeds the demand now. So it's available in the community, and those locations are listed on the county website as well.
Okay. We done with that item?
It's 1.1 million.
1.1 million? Okay, number 4, is that what we're up to? Discussion, concern, and possible action regarding approval of the trust financials through June 30th, 2021.
Good afternoon. I'll just briefly go review the financial information with all of you. For the fiscal year that just ended June 30th, the EBT fund itself, not the SIR, but the EBT in a pre-audit status ended up with a loss of about $280,000. There was a sufficient fund balance. We've been discussing fund balance for quite some time, and I know that you're comfortable with the fund balance, but there was sufficient fund balance to cover that loss. I did note in your packet that there was an increase of about $1.5 million in cost and claims from the prior fiscal year through 2021, through June 30th, 2021. And as we now know, of that increase, 1.1 million of it was related to COVID. And the balance, I'm making some assumptions here, but could be cost increases. They could be that more people went and had procedures done that had been deferred through the initial COVID, and some of those types of related costs. Going forward, we're also anticipating that there would be some continued costs related to COVID, and I would estimate that these are still in a similar range as what we've just experienced. So based upon that, then I would just again remind you of the value, so to speak, that there is in retaining the fund balances that we do have in order to mitigate those costs as they fluctuate as we go forward. For the fiscal year that just ended, based upon the actual revenues, the actual expenses, we do have a fund balance of about $9.7 million pre-audit, and we had budgeted contingency of about $8.9 million. The actuarial recommended reserve for last fiscal year was $7.4 million, so we exceeded that on all areas. But it's been a while since we've actually incurred an operating loss for a fiscal year, so that was really just the primary point of the current year. So I'm open to any questions that you might have on the current year, and then I'll move on to the budget that was adopted for the EBT.
Okay. Anyone have questions? You can move on.
Okay. In your packet on page 31 then is the budget that was adopted. This does mirror what was previously discussed with this board, actually, when you at your last meeting, and you had adopted the updated rates as proposed for all of the items that were included and any additional rate increases. So with the budget that was adopted, we included a revenue stream of about $13.5 million. This is a little bit less, obviously, than we had for actual in the prior year for 21. Most of the additional revenue came from the health service initiatives. So we budgeted a very low number. Those initiatives are noted as being the funds that were received back from those prescription changes. So in the prior year, it was from Navitus, and that's the prescription company. So that's where the bulk of the increase came from in the actuals. And our budget increase is about $500,000 is all that we increased the revenue. On the expense side, knowing that we had the continued COVID claims and the otherwise few increases in service and administrative cost, we budgeted $14.9 million, so that's an increase from $13.5 the prior year. That's about that $1.5 million increase. It would still leave us a contingency of about $8.4 million. The actuarial recommended reserve that you'll be discussing is about 7.5, 7.6, so we're still ahead of that. So if there's any questions, I'd be happy to answer any line item information that you might have.
Any questions?
Madam
Yeah.
Chairman, this is Susie.
Yes?
I do have a question on a line item on the expenditure for the upcoming budget.
Okay.
Identity theft. I see here that in prior years we don't have a budget for that, and all of a sudden for this coming fiscal year 2022, we budgeted identity theft. What is that?
We talked about that. We voted on it. Do you want to explain?
Sure. I can talk about it a little. Okay.
Oh, okay. No, I understand.
It was in response to the identity theft when, they were doing the COVID checks and stuff, and Supervisor Johnson had some issues that our employees were being targeted, and that it was just a benefit that we voted to give to our employees.
Yes, now I remember, Madam Chairman.
I knew you.
Okay.
Okay.
And so to add to that, there was a layer of the level that an employee could opt into. So the layer that the county covered through this trust was a basic level of service, and that's I believe $3.25 per person. That is being paid for by the trust. If the employee opted into a higher coverage to extend to their family or their beneficiary, then that is on the employee. It is not a cost to Mohave County. Help clarify that.
Sound good, Susie?
Yes, but I have one more question, Madam Chairman. Coral, when we do have claims that are not paid in the fiscal year, and I know there's another item on the discussion on those incurred but not paid or reserved but not paid, do you normally obligate the expenses of those claims for the fiscal year, or it was incurred, or you budgeted for the next budget when you think those claims will be paid? Outstanding claims.
Okay. So it's kind of a mixed answer. But from the practical standpoint, not within the financial statements, but just the practical cash-based standpoint, the claims are open through August 30th, and that is by statute for local governments, that our books are open for 60 days following the end of the fiscal year. So if there was anything that was incurred but not reported as of June 30, we still were able to pay the bill for that for July and August. Those claims that were actually paid then are within the information. And then the items from the prior year during that time period were in the prior year, and so on. The IBNR value on the financial statement presentation is shown in the balance sheet as a liability of funds that may still be coming due or be paid in September, October, November, December, basically within the next 6 months.
Okay, that reserve then, that IBNR reserve,
Right.
is the one that takes care of those claims.
Right.
But in terms of expenditure reporting, is it reported on that fiscal year where it is incurred, or it's reported as an expenditure for the fiscal year where it was paid?
It's reported only by the fiscal year, and we include, though, anything for July and August. So it's the fiscal year plus July and August. That was a bill for June or May or April or anything in the prior fiscal year. But they do have to hit
But anything
in that
beyond
first 60
that,
days.
anything beyond August is then reported in the next fiscal year.
Yes. So if it was
Expenditure.
if the claim, if somebody went to their doctor's office, let's say in April, and they were billed, or the insurance was billed in May, and there were some discrepancies, and it's ongoing, and it's lasted until September, and then it's resolved, and all of it or a portion thereof is paid by Meritain, essentially. But it's paid in September, October, then that is the next fiscal year's expense.
Okay, all right. Thank you.
Okay.
Okay?
Okay.
All right, so what now?
And I think that is an action.
We have to vote on approval?
Okay, that is an action that you would need
Right.
to,
Vote on 4 and 5?
for number 4 for this one, to accept and approve or to not accept and
Okay.
approve.
I need a motion.
I so move to approve.
Second it.
We have a motion second. All in favor?
Aye.
Aye.
All opposed? Motion carries. Okay, number 5.
And I think number 5 is your budget, right?
Correct.
Okay.
So what government would be complete without multiple budgets, Madam Chair? So that was the internal budget. This is the trust's external budget. So basically what this one is to show you, is that we took the final adjustments, kind of like you adopt a preliminary budget and final budget. So you'll remember that we had those final discussions that included the identity theft, shifting some money. We had saved some money on stop loss, so it gave us some additional money to put into the claims fund. So literally all this does is reallocates those line items to correct it. If you look in the memo, Amanda has done a really good job of calling them out. Frankly, they're pretty simple. So we did the actuary's recommended funding. We wound up between the minimum of 0.4 and 4%, covered the funding for expansion of the Livongo program, added the identity theft protection, and then contracted out the Cobra to Meritain. And we did that primarily off the savings from the reinsurance rates, which you're going to approve later. So all we're doing is we left the rate amount exactly the same, and then shifted the dollars between those line items. So this is the final budget for the trust from our perspective.
Very good. Anyone have any questions or comments about the final budget? Nope. Okay, then I need a motion.
Need a motion on that?
I move to approve the final budget.
Second it.
Motion and second. All in favor?
Aye.
Aye.
All opposed? Motion carries. Thank you. Number 6, discussion, consideration of, and possible action regarding Blue Cross Blue Shield Arizona PEPM fee increase and network request for proposal.
So, Madam Chair, this is, we have Rachel Martin from Blue Cross on the line. So this is a recommendation from Gallagher that we take the Arizona Blue Cross network out to RFP. The background is we had a meeting with Blue Cross a couple months ago. They indicated at that time that the per employee per month charge for the network would be going up somewhere between $2 and $4 per employee per month each year for the foreseeable future. So we subsequently said, guys, it's not going to fly. And what's really happening in the background is when you buy that network, you buy the list of providers, kind of like we saw with the IBH, right? You buy the list of providers and you buy the discounts behind it. And there was a time when Blues could charge a premium for their network because their discounts were that much deeper. Okay, we are no longer convinced that that delta exists, and certainly not with an open-ended increase. So subsequent to that conversation, they did come back and say, hey, well, maybe it won't be that far. It's going to be somewhere in the $20 range is our target. But again, frankly, it's written on the wind. If it's not in the contract, if you don't have the rate locked in, it's written on the wind. So our recommendation is that we contract with Buck as the actuary for the trust, who has all the in the weeds information, and have them conduct an RFP to see if Blues is worth it. And basically that's really what it comes down to. And I have to add a caveat. Rachel Martin's on the phone. Rachel is new to this account. So she got handed this bomb to come deliver to you guys. So I'm trying to distinguish between the messenger and the message. But I want to let her, with your permission, Madam Chair, if she had any comments on that. But staff recommendation is contract with Buck to run the RFP to compare the networks for the Arizona, and we have Aetna's network nationally, and see if it's worth keeping them and at what price. And my goal from that is to get the rate locked in for a period of 5 years, so we don't have to deal with these big caps and lack of caps. That's all I have, Madam Chair. With your permission, I'd like to turn it over to Rachel and see if she has anything she wants to add.
Let's hear from Rachel. You say?
Thank you, Madam Chair and trustees. So thank you for the opportunity for me to allow me to speak. I have been working with Aaron and the team behind the scenes since I was provided the news of our rate increases. So I can tell you this much. I continue just as of yesterday morning. We do here at Blue Cross Blue Shield of Arizona have a new general manager that has taken the helm, and he is responsible for our profit and loss in our organization for our commercial sales, which includes the business that we have with you today and have had for quite a long time. So sitting where I sit, the Mohave County Employee Trust is a very important client. You service, what you do for the community is exactly where you help us with our provider relations network. You help the community and solving and resolving just communal events, which Blue Cross Blue Shield has always been very, very near and dear to our community. So I have to tell you that I continue to fight on your behalf as well as Gallagher's to maybe take a different approach when we receive this RFP request to continue to maintain your business
with reasonable, if at all, pricing and, to support that 5-year agreement. Personally, I do not want to lose you as a client, nor do I want to lose working with Aaron and Amanda. So I thank you for allowing me time to speak. But please know that the fight is not over on my end. And, I think I'm personally also looking forward to seeing the results of the RFP.
Okay, any questions?
And Madam Chair, we did provide a recommended motion.
Excuse me?
We did provide a recommended motion in the memo.
Okay.
We're binding it.
Okay, I have a comment. It's a little disappointing. We've worked together well with our providers. We've all kind of been in this together. I know that might sound a little corny, but I'm a little disappointed in this to come like this in front of us. And with that, I'll entertain the motion.
I move to approve the network leasing request for proposal with a July 1st, 2022 effective date and authorize Ken Cunningham to work with Doc Gallagher and counsel to the trust to finalize the scope of work and then approve the RFP associated costs with not to exceed authority of $34,000.
Okay.
Second.
Motion and second. All in favor signify by saying aye.
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 Aye. Well, is there anything you want to say? All opposed? Yeah. Okay, and that motion carries, and let's see what we can work out, huh? Number 7, discussion, consideration of, and possible action regarding 2021 incurred but not reported claims reserve.
Okay, Madam Chair, for 7 and 8, I've got Chris Marshall with Buck on the phone. Chris is the actuary that's worked on the account for probably 10 years. So the IBNR goes to Trustee Duranzo's question, right? So the IBNR is an estimate of the outstanding claims where the service has been provided, but that basically the check hasn't cleared, plus an administrative component. And frankly, the contingency for this is really twofold. One, you report it as a liability on the county's books because, as Trustee Duranzo mentioned, it's out there, right? The service has been provided, the check just hasn't cleared. But really where it becomes significant is in the event the trust ever shuts down, partially or in total. And basically that surplus money that was set aside to weather storms as we're doing right now, we would draw that down, pay out all the final claims, pay the administrative stuff, shut the trust down, and then move on. And then by statute, if that ever happens, then the balance is required to be turned over to the general fund. But so anyways, when you look at this, and I'll defer to Chris, but basically we have a $60,000 increase year over year, and that's considering the COVID impacts. So I would say all in all, Madam Chair, not a bad year. Happy to answer your questions or have Chris jump in.
Okay, any questions? Don't think so.
Need a motion.
So right to the motion.
Motion to approve the 2021 incurred but not reported report as presented.
Need a second?
Second.
All in favor?
Aye.
Aye.
Opposed? Motion carries. Number 8, discussion, consideration of, and possible action regarding the actuary recommended financial reserves.
And again, just to summarize, I'll defer to Chris as he wants to jump in. You have questions, Madam Chair. So really the only thing you have to carry is the IBNR. That's the absolute minimum, okay? So based on the trust performance, we had the actuary a number of years ago start working to identify a solid number. Really, what should we have for contingencies? And the contingencies are, do you get surges in claims, right? Frankly, for a long time, I used pandemic as an example, but never thought it would happen, right? Here it is. It actually did happen. So this is actually an additional amount to basically smooth out the storms, okay? And in essence, what it comes out to is about 6 months of contributions to have on board. We're more than that. We exceed it today. I would just point out on a note, having worked with this trust and having over 30 years ago been an employee in Mohave County, that I really don't think any of you as elected officials can win, right? But I would just tell you the fact that you have this surplus, the fact that you're sitting here today weathering COVID as if it didn't exist, handling, we had 1.1 million in unbudgeted claims that went through and nobody blinked, right? We're able to do all that. This strategy, this conservative strategy, is about as anti-government as you can be with unfunded liabilities for Social Security and pensions. But frankly, it's why this trust has been so successful. The thing works. So it gives an objective measure. And I would note too, Madam Chair, because I know you were involved with these, and Verlin, I think you were here. Roger, I know you were here. But when we got above that number, what happened is the Board of Supervisors and the trustees worked and said, hey, we don't need it. We have vital services we need to provide. And we actually provided kind of a mechanism for the trust and to help facilitate those operations. That is not normal. That's rational behavior amongst adults. It's not normal. But I just pointed out to you because you should note the successes. And the financial success is always the very foundation of anything else you're going to do. You got to be solvent, and you are. So that little attaboy, attagirl, because it's working well.
Good. Any questions, comments? I have a comment. We've consistently, I've been doing this now for going on 9 years, and we've consistently been doing very well. I think maybe there was 1 year we were on, and then there was the year we actually took money out, and because we were, like we are now, we were a couple of million over what the actuary said, and but that was because the economy was bad. We really needed that money for something else, but we are in a pretty good place right now. So I think that prudence and the conservative way we're doing this is warranted. So I'm okay with all of this. Anyone else?
Agree.
Okay. What's the pleasure of the board?
I agree.
Madam Chairman,
make a
I
motion
move to approve the recommended financial reserves as presented.
Okay, 1 second. Motion to discuss.
Oh, okay.
Did you want to say anything, Berlin? Oh, okay. Okay, we have a motion and a second. All in favor?
Aye.
Aye.
Opposed? It is done. Next up, discussion, consideration of, and possible action regarding ratification of the 2021-2022 reinsurance.
And Madam Chair, we talked about this one at the last meeting, so again, like the budget, you're basically formalizing what we discussed. On the stop loss or the reinsurance, we had budgeted a 30% increase on the big parts, 5% on the smaller. Frankly, we got lucky. It came in at 4.62. And I say we got lucky because I had to stand in front of another client where we budgeted 30 and it came in at 40%. So it literally comes down to some timing on when the large cases hit, when they mature relative to when you're negotiating. So when we got this done, this freed up from the budget internal to the account. It freed up about $322,000. And you might remember that's how we paid for the identity theft. That's how we paid for the COBRA. And we actually budgeted a little bit extra into the claim fund. So we redistributed that cash in the budget you adopted earlier. So what you're doing today is approving it's already been bound. You are retroactively approving Ken's signature, and this was the most favorable by quite a margin of the quotes that we received.
Okay. Questions, comments? Motion.
Motion to retroactively approve the 2020-2021 stop-loss contract with Sun Life as presented.
Second.
Okay, we have a motion and second. All in favor?
Aye.
Opposed? Motion carries. Number 10, administrative update.
No vote on this one, Madam Chair. Just a notice, we did have the PCORI fees. This was actually a surprise. At the last year of the Trump administration, this Freddy Krueger had died, and they reinstituted it. And it's basically everybody that's covered under insurance has to pitch in. So for Mohave County for the year, it was $42.39 to fund the Patient-Centered Outcomes Research Institute. I've heard it. I've said it for 10 years. I've never seen anything come the other way. The checks go, okay? And then just an FYI that we're planning, or we'll start the planning with Jade and Ken on the annual renewal meeting for March. Just FYI. So we're hoping to be able to do it in person this year. Yeah. Okay. That's it, Madam Chair.
Second.
Thank you all.